I am Kim Harrison. I am a paraprofessional for the Covington City Schools. I will be entering into my 21st year. I've been employed at all three schools. I enjoy working for the Covington City School system, but I do have a few concerns as a paraprofessional. So, first though, I would like to thank each and every one of you for everything. I know how hard it has. I don't know how hard, but I can only imagine how hard it is to make the decision that you have come to, and I appreciate each of you. I would not, and I've said it before, I wouldn't want that job that you guys have. I'll keep mine. I understand that some of the answers are still being formed or planned, but would like to pose the following questions. Some of these were answered previously, but when you say we'll encourage staff and students who feel sick to stay home, are we going to encourage that or require that? Enforce it? That sounds good to me, because I have a chronic health issue, work with small children, and they sneeze, they cough on you. So that is relieving to me. And if they are, what's the criteria going to be for them? Are they going to be sent home? And their return criteria.
That there will be a fever, or what might be the criteria that they were sent home. We have a fever policy of 100.4. They have to be fever-free. Our school nurses will monitor that. I think we have a much better policy in place. We're looking at all the symptoms on the chart, on the entrance form that you use. That will be our criteria for every student. So that's going to be our practice from day one, making sure staff will do it before they report to work. Staff that walks into the building will have a temperature taken, as well as the check. They've already done self-check before they arrived. And if any of those things are checked as a no, you will not be working, the student will not be present. We will have a vehicle parked at every school. If there are sick children and we're unable to get their families, we will contact the families, isolate the student, and then get them home with the proper protective equipment and make sure they're healthy and stay home until they're well. And require doctor's notes before they return based upon their symptoms. Thank you. I was
glad to hear about the doctor's note. Back to the masking. Are we not enforcing this? Or are we?
Masks are recommended if you cannot maintain the 6-foot social distancing. And the plans that we have in place right now, our students will wear their mask into the buildings. They will go into their classrooms in social distance at their seats. If they leave their room to go to the cafeteria, they will put on their mask. Staff will all have on their mask if they cannot maintain the social distancing. That will be the same procedure as they exit the building. But as one parent said, some students have a challenge with the mask. Face covering, I like to use that word better. So we've got a lot of work to do with the enforcement or the practices of social distancing and those face covering. I think we can do it. We can do it, we will do it. So it will start on day one.
And that's kind of a partnership with the family as well. So we have to work it from both sides.
Right.
And I guess will a doctor's note be required if they're not wearing masks?
If a child or a family member has a medical condition that says they cannot wear a mask, or suppose they have a significant anxiety for wearing a face covering. I need to start using that face covering. Yes, a doctor's note will be required. And that, we'll have to look at each of those on an individual case by case. That's why we're starting to take data on our staff. We'll start taking data on our students and trying to find out what families feel they have concerns about with the social distancing as we move forward, and with the face covering. So we will do all those things to get us back on the right track from day one, or on the right track.
Now, what is going to be the plan for a confirmed case inside the school? Have you decided? Will we have?
Okay. We just got from Dr. Odell's office today a template letter for what we do if we have a confirmed case inside the school. So we'll be following those VDH protocols and CDC protocols, and we will be doing the isolation. We'll be doing the quarantining. If a classroom is exposed, we'll be following all the CDC and VDH guidelines. I'll be using a lot of expertise from the local health department, and they have been very, very proactive in providing that support to us. And we will make sure that we do what's required to keep everyone safe should there be a case. And there are staff meetings planned after a decision is made to come and explain the policies to our staff. It's important that you know, and the families know what our practice is and it will be, and that is in progress. So,
Thanks for consulting the VDH in this instance.
they've been wonderful. They are our guidance. They are very, very concerned about us and the community and us in the state of Virginia, and I applaud them for all that they're doing right now in this time.
Back to the cleaning daily, I am a little concerned. Our janitors I like to say custodians, do a wonderful job, but we're limited on how many that we have. And I know within our schools, Edgemont,
Question. Last year we had a struggle with custodian staffing in that building. We have hired an additional custodian that began work July 7th. We're going to hire a part-time custodian to work during the school day because we know we need more support with cleaning the school. So that's a well thought of question, and we are working, and we've already solved that problem. So it's going to be much better than it has been.
and I guess one more thing that I can think of is we're asking parents if they can possibly do it to provide transportation. Now, normally it's paraprofessionals that are out there doing the car rider duty. So I had that job also last year. Is there a protocol there?
There'll be a meeting like you wear certain kind of protective coverings and things like that. Is that your
How would we be protected there? Will we be doing the screenings or?
The self-screenings will be done by families before they arrive. And then there'll be something like you've seen in the back, a kiosk at every school to help the children walk in and have their temperature taken. And we will have training on that as well for each school to help prepare for that.
Because we open car doors.
And that might be something we have to think a little bit differently.
Okay.
This situation this morning. But again, that's an excellent question for us to think about for a positive solution.
Okay, thank you for answering these.
Thank you.